Hello everyone, it's Dr. Durst with Revitalize MD, and today I want to show you a combination treatment that can improve lots of different things, and it's filler and Botox, and it's on a newbie, so she's never had it, a little nervous, and you'll look at the before and afters and see how amazing and natural she looks. All right, so here we are. This is just cleaning off the area with some alcohol, prepping for Botox, which again is a verb. Botox can mean you're doing Botox, you're doing Dysport, you're doing Xeomin. There is a newer one, but those are the three main ones that we use, and they all paralyze muscles. She's a newbie, so Xeomin's not like a bad choice for her. But you can use any of them. It's going to paralyze muscles, and of course, anytime you put a needle in a face, you can actually get a little bit of bleeding or bruising. It's pretty unusual, and even if you get a little bit of bleeding, a little pressure will stop that. And this is all Botox into the muscle that will paralyze it over the next 3 to 5 days. So those frown, now you just saw all the forehead lines, and now putting Botox in is making those, they will make those disappear. So basically, she's injecting into the frontalis muscle, which lifts, and that's the only lifter of the face. So you cannot do that frontalis without doing the frown lines, which she did first. Now this is crow's feet. So all those wrinkles around the eyes, this is what she's treating right here. And then she'll go to the other side and do the same. You saw those wrinkles? Well, guess what? In a couple weeks is the max effect. So about 2 weeks is max effect. Prior to that, you don't want to do any touch-ups. After that, you can touch up if there's still something. Now we're going to filler around the corners of the mouth and the outside of the mouth. You see how nicely that already lifted that lower lip and the corner. So what she's doing right now, she's got some jowling, and so she is placing filler in the corners of the mouth to lift the corners of the mouth, but to also lift that heaviness that we get that is forming the jowl. So a lot of people are bothered with jowling, which is, the fold below the mouth and at the corner of the mouth and between the chin that we notice, and it bothers us. And so some people will get some filler in the area in front of that, but that will look unnatural over time. And instead, you can do that if it's subtle, but instead sometimes lifting, like right now, she'll fill out the corners of the mouth, it turns up the mouth, and then it also lifts that jowling. So it's a more natural look, and it takes away the jowling, fills out the lips a little bit on those outer aspects, and you can see this patient has a beautiful lip definition. And so just defining that outer lip a little bit, turning it up, is a perfect and very subtle improvement. And nobody knows you had it done, but it improves what's bothering you. And here we go a little bit more, just filling out the outer lip and lifting that area. And you're going to see in the before and afters how that changes her face. Not dramatically, but very naturally, to improve what areas were bothering her. And again, this patient is a new patient to filler or Botox, and she got it all done in one. And again, it doesn't take a large amount of volume to change some subtle areas that are bothering you. And she is not having any discomfort, just with some topical numbing. Nothing was uncomfortable, and she was a newbie, but guess what, guys? It's addictive. You'll want more, because if you do it in small amounts and more frequently, if it bothers you and it needs to be changed. Right now, she's just checking for movement, and right there, she's kind of still pulling down a little bit with the muscle, so she's putting a little Botox or neuromodulator to paralyze the muscle. Again, Botox is a verb. It can be anything that paralyzes the muscle. And now you're going to see some before and afters. So we're going to start with just the Botox. Again, Botox being a verb can just paralyze those muscles. And so those frown lines in between the forehead, the scowls, the scowling lines that sometimes people don't even know they have. But when you actually form that contraction and movement, you see them, just like in this picture, and then they're gone after, just with some simple treatments there. Paralyzes the muscle and smooths it all out. Then what you're going to see next is the forehead. You get those lines, and again, sometimes it's movement lines, and so you're only going to get them with you when you move, but eventually they're going to form deep lines over time. So you want to prevent that movement and prevent the line formation, because then once you get the line formation, then you got to look at other things to erase it even after you get rid of the movement. So see how smooth their forehead is? So if you want a smooth, shiny forehead, then Botox is what you want. Then now you're going to see some results of the filler. So again, very subtle changes. Her lips were already very well defined and beautiful, and now you can see a little bit of filler on the outer aspect of the lip that just makes it a little more prominent and beautiful and luscious, and then you have some filler that lifts at the corner of the mouth, so that jowling that you see is now gone. So if you want to lift and get rid of that jowling, then filler and subtle placement in the right areas is the way to do it, as you see. Then we're looking from the front view. If you see her lips are asymmetric there, you know, again, her lips at the corners are going down, and she's got a little bit of, you know, the wrinkle lines around the mouth. And just with that subtle volume replacement, now she has symmetry to the lips. They look more luscious, and the outer aspects of them are lifted now, and those smile lines and volume loss are gone. So again, combining treatments do not need to be too much, and it doesn't need to make you look abnormal or unnatural. And that's a myth with fillers and Botox. You just need to see the right office, the right providers and injectors, and get it done the right way. That's it. So please like and subscribe, thumbs up button, comment, you know, let us know your experience with fillers and anything else you might want to hear more about. And again, we're here to revitalize your look, your health, and your sex life.